So I'm here with Patrick Bryant, who is a practitioner of internal family systems, and he's going to just kind of do a little question and answer with us today. Patrick, can you just tell us about yourself a little bit?
Sure. I am a licensed clinical social worker, alumni of UGA, a School of Social Work. Actually, I'm, I guess what you call a double dog. I have my undergrad and graduate degrees from UGA. I've been practicing for, 11 years. I've been in private practice for 8 years. And we have a private practice in Decatur called The Peaceful Place. It's actually more turning into a holistic health center. We've incorporated some other holistic providers into the practice. So yeah, as you just said, I operate from an approach of internal family systems, also a mindfulness-based approach. And as I'll talk about later, perhaps those two work quite well together because of what's necessary for both to be effective.
Okay. So I guess, so I'm interested in finding out what is it about internal family systems that draws you to it, and maybe as you answer, you could talk about the mindfulness space too that you just mentioned.
Yeah.
It sounds like they might be in the same area, right?
Right. Yeah. And this is a question I really enjoy answering because mindfulness is not a new concept, right? I mean, it originates out of more Eastern traditions, specifically in Buddhism, where it's part of the Eightfold Path. In case anyone isn't familiar with it exactly, it's simply paying attention to right now on purpose, from a place of kindness and curiosity rather than shame and judgment and needing to label or grow attached to particular outcomes or things. So how that shows up in therapy, maybe it's intuitive, but just at risk of over explaining it, it's really about being attuned, being present with the person, and in IFS, that person's parts, which I'll talk about in the room. So probably the main thing that drew me to IFS is its humanizing components. It teaches us as therapists and as the client to see ourselves and the other person in the room as a complete human. They're already complete. There is nothing that we are going to add necessarily, and we certainly aren't going to fix anything. So it's not creating a dependency upon us as the provider to somehow give them something. It's us as a guide. We are simply here to help them negotiate and navigate the parts in order to integrate them. And that fits perfectly with a mindfulness-based approach because being mindful is about being present with what's showing up. It's not so tunnel vision, though. I think that's a misconception of a mindfulness-based practice. It's not tunnel vision where we let go of everything that we know about this person or about reality and just focus on whatever happens to be going on. It's not quite like that. We focus on what's going on in relation to the reality, in relation to this person, where they are, where they're trying to get to. And IFS is really great with that because the premise of IFS is basically that we're all comprised of parts. There is a self, which is at our core. This is our core being. And just to kind of drive that home, there are components of the self. Richard Schwartz, who developed the internal family systems back in the 80s, he has the 8 C's of the self. It's calm, compassionate, curious, courageous, creative, connected, confident, and having clarity. That's how you know you're being self-led. It's the language that we use. Are unblended from the parts.
Okay.
And that's really what we're trying to get to. We're trying to get clients to step back from the reactivity, which is a part taking over or blending, and really just be themselves, whoever they are. and see things for what they are, which is also how mindfulness comes into this. We see things how they are, without needing to attach to, well, I really wish I had someone else's life because of whatever my perception tells me about that person's life compared to mine. And it lets go of perfectionism. So we're already complete. We just enable or really empower our clients to find that balance. I think a really good way of conceptualizing this that I use with my clients a lot is thinking about a boardroom. And in that boardroom, you have the executive or the CEO, and then you have a lot of committee members. So that executive needs to understand that they are in that chair. So in IFS, that is the chair of consciousness, the seat of consciousness.
What is it that draws you to internal family systems?
Sure. So the main thing that draws me to IFS is its humanizing component. So it really sees every individual as already being complete, already having everything they need to heal themselves or to thrive, so to speak. The therapist is no longer, from this mindset, we are not being dependent upon as giving them something that they've never had or fixing a problem so much as it is guiding them or helping them integrate their parts and be self-led, which I can talk about in a minute, such that they can navigate their own existence. Right? So, one thing you may notice is reactivity. So someone becomes incredibly reactive or maybe even dissociative. So what we do is we stay fully present as the therapist in that room with our client, and we help the client understand what's happening. And this is where mindfulness is a really good partner in this, is that it requires a lot of attunement and presence, both from the therapist and the client, but mainly the therapist, because it's for us to hold that space. So we're seeing what's happening, and we're inviting the client to take a couple steps back from whatever part or parts that are being reactive. And these reactions are all about self-preservation or protection. So we want the client to be self-led, which requires us to be self-led, which requires us to be fully present and attuned to ourselves as well as the person across from us. And just to go over those 8 C's of self again, because I think those are important. It's calm, compassionate, curious, courageous, creative, connected, confident, and clear. We're having clarity. That's how you know you're in the self. And maybe you've had a moment where you've been perhaps working with a client or doing something in your life where you are you don't know really how things just happened, but they just fell into place. You were just on. That's another way of saying it. That's being self-led. It's not dissociative. You're fully present and you are on.
Is it similar to the concept of flow?
That's a good question. I don't know what Dick Schwartz would say about that. I find it to be quite similar to flow.
Okay. So when people say, yeah, I was in the flow and things were just moving, that's kind of what you're talking about?
Yeah. Except I would add, which is still congruent with flow. It's not things happening to you. You're in control. You're in the driver's seat. So even though the flow, maybe things are falling into place, but you're doing that. It's not just, the universe is somehow lining up perfectly. No, you're doing that.
Okay.
Yeah. And so again, the IFS is really just the kind of synopsis of it, because it can seem a little complex, right? But it is a little bit intuitive as well, because you'll notice some flavors of lots of different models, lots of different approaches that you've already been using. So the real premise here is it's based on the understanding that everyone is comprised of parts. And sub-psyches is what Dick Schwartz calls it. So sometimes these parts get reactive, and they're reacting to something that's happening that causes discomfort or distress or could be a potential threat to our existence. So they're well intended, but like a lot of time things or people that are well intended, they don't always serve us well, even though they're well intended.
Right.
So there are two basic types of parts, two categories. There's exiles,
Okay.
and then there are protectors.
Protectors. Okay.
So the exiles are your more vulnerable parts. These are the ones that often manifest as childlike or a much younger part. They're very vulnerable. So they're the ones having or carrying the burden or the problem.
Okay.
Okay. And the protectors are they're exiling the exile. They're the ones banishing this part because, gosh, this part is messy, and if it were to take over, things would not go so well.
Mm-hmm.
And I can't remember if did I talk about the metaphor of the committee room before or after our lag?
Before our lag.
Okay, so a good way to kind of conceptualize this is the self is a CEO.
Okay.
And in IFS we call that the seat of consciousness. You are you. And then we have all these parts, right? They're the committee members. And sometimes the committee members, well, they have something to say. So for us to kick them out of the room or to ignore them or silence them in some way, it doesn't actually serve the board very well, because maybe it's valuable and it also doesn't make them shut up. So maybe being unheard or invalidated just causes more reactivity, right?
Yeah.
So having the confidence, one of those C's, and the curiosity to just be in that CEO chair and hear that committee member out. What are its needs? Well, so that's like an exile, right? It has a lot of needs and it's being really reactive. So we don't need to exile it, to kick it out of the boardroom or fire it necessarily. It could be having some really valuable information for us to heal more sustainably.
Okay.
So we hear it out without the risk of it taking over.
Okay.
Now, this perceived risk of taking over, that's the protectors. That's why we have them. So the protectors are basically classified into two subcategories. So under protectors, there are firefighters and managers.
Okay.
So go ahead.
Let me pause right here. I'll be right back.
Yeah.
I don't know if you can hear my daughter in the other room, but I'm going to go shut a door.
Okay, that's totally fine.
Okay. So you were talking about firefighters and managers.
Yeah. So the firefighters are reactive.
Okay.
They're the ones that something's happening and they need to snuff out the threat.
Okay.
Or get us away from it. And humans respond to two basic things: pain and pleasure. So if there's a perceived threat, we need to either eliminate the threat or get away from it. And so firefighters are reactive. Like I said, their behaviors are going to look more like lashing out, minimizing someone else, fighting, quite literally. It could be numbing or escaping through substances, alcohol, dissociation. That's another firefighter tactic.
Okay.
You see that a lot in trauma, right? So people dissociate to get away from this thing, to preserve the person. A manager, however, is more of a proactive category of parts. These are the ones that are going to really analyze, or you're familiar with being stuck in analysis paralysis. Right? Yeah. So they're the ones that are over analyzing, trying to figure it all out before we take one step. They're the ones that are also going to be shaming. You could maybe even pull in some Freudian psychology here and see that as the super ego. They're the helicopter parent that comes in and tells you all the things that you should have done and you should have known better and you shouldn't be doing that. So that's a real common thing that we see in managers. And when we hear the shame component, we know a manager is now blending with the self. When this person's worldview is all about I'm not good enough. I should have known better. If only I could just be blah, blah, blah. So that's proactive. It's preparing you for a larger scale of life and how you navigate life rather
And
than.
tell me, so you mentioned the word blending with the self. What is that again?
Sure. So blending is essentially going back to that metaphor. That's when one of the committee members jumps in that seat with the CEO.
Okay.
And they are just right there together. And so, as the outsider looking in, it could appear as if one of those parts is the self, as if that person is naturally this way.
Okay.
But the way we know the difference is if that person is not compassionate, is not curious, is not centered in the present, all those 8 C's, if that's not happening, but instead they're reactive, well, that's a cue to us that there's a part blending. There's a part not getting its need met, or a part actually trying to keep that exile at bay because that exile is not getting its need met.
Got it.
Maybe a real life example that you would see to help make this make more sense is, let's not get too intense here. Let's think about someone who comes in for, they're just struggling with a lot of stress. And maybe it's work stress. Maybe it's just a lot of uncertainty, a lot of confusing stress over the last year and a half, because it could be work stress, could be relationship. They don't know. It all looks the same because they're just sick and tired of the way things are. So, it can be a little messy. It can be a little confusing when they first come in, and maybe they're just word vomiting. There's just so much going on. Well, the more we start to understand, the more we see they're not being self-led right now, because there's a lot of judgment. There's judgment toward other people. My boss is an idiot, or my partner just really sucks. If they could just understand, my life would be so much better, or whatever it is. Or I'm terrible. I'm just inadequate. Nothing I ever do is good enough. I just need to blah, blah, blah. So what we do is we pause. And now this also, again, requires us as the clinician to be very attuned and very centered, very present with what's happening. See this person as not a reactive person, but a part has now blended, is now in that seat with the CEO. So we say, hey, I notice there's a lot going on right now. Seems like you're talking really fast and you're telling me all these things, and I'm hearing a lot of shoulds in there. So I'm wondering, is this always true? Is this always true for you? Can you imagine a time where it wasn't true? Well, that's kind of helping them understand that there's a little difference here. And maybe they're already using the language. Quite honestly, most of the time, I hear clients or just anyone out in the general public using the language of, a part of me really thinks that I should be leaving my job or leaving my partner, but another part of me just won't let me go. Well, they're already using the language. They just don't know necessarily yet what we're talking about. So we feed into that. It's not our job to name or label the parts for them unless they ask us to. We roll with what they're presenting. Oh, okay. So a part of you is really upset right now. I mean, it is just tired of where you are. Yep, absolutely. I'm so sick of this. Okay. Well, I would like to invite you to try to take a few steps back from that part so that you can kind of see the part as it is. This part of you that's just so sick of where you are. And sometimes people go right into it. Sometimes they're like, what are you talking about? And so that's when I'll give a little explanation of, okay, so just humor me here. We're just going to kind of allow this part of you that's really upset right now to manifest as its own sub you, or I'll use the metaphor, a committee member in the boardroom. And we want to actually engage with that part. So that's going to require you to get back so that you can actually have a conversation with it. Are you okay with that? And most of the time they say yes. And if the answer is no, then we don't do it. We figure out what we need to do to get to that place.
Okay.
But for the sake of our time, we'll just fast forward and say, that works.
Okay.
So it's, we engage the part. Hey, what is it that this part is reacting to? Are you aware of that? And maybe they come up with something. So I'm just so tired of feeling like nothing works. Oh, okay. Well, is there any compassion, or how do you feel toward the part of you that just can't get it together? Nothing's working. Well, I hate that part. I really wish it would just go away. All right, now we have a clue of what's happening here. There is a protector exiling a vulnerable part, a part that just can't quite get it together and is feeling whatever it is that they're feeling. So when the client says, I feel, when we ask, how do you feel toward this thing that's happening or this part, and they respond with anything other than curiosity or compassion or something that sounds like, you know what, I can befriend what's going on here, then we know that we've got some work to do with the part.
Okay.
So the protector part that is blending and saying, absolutely not. Or the exile that's taking over out of fear of being exiled. So the general synopsis here, without getting too much further into the weeds, is we help the person really come into self. There's some exercises that we can do for that. It might just be your generic grounding exercise, like a 5-4-3-2-1. 5 things you see, 4 things you hear, 3 things you can feel and what they feel like, 2 things you can smell, 1 thing you can taste. Or simply curl your toes and really feel yourself here in this place. Feel what's underneath you. Or maybe doing some breathing exercises, helping them find these feelings in their body. Hey, where do you feel that stress, or whatever the word that they use to identify what's happening? Where do you feel that in your body? Is there a place you notice that the most? Also something we would use in a lot of mindfulness-based practices. So we help them identify that. And a lot of times the self is here. It's right here in the chest. I don't know if my camera's picking up where my hands are, but it's right here in the heart center, right? So if you're familiar with energy work or chakras, it's going to be right here in the heart center. We really feel that. So we embrace it and we say, hey, really breathe in to this place. Do you feel something? Sometimes it's warmth. Sometimes it's flow of energy. Okay, I want to invite you to really just spend some time there. Get familiar with this place. And now from that place, let's look at this other part. Maybe you ask it what it's afraid of. What are you afraid of happening if you don't react this way? And that gives us a lot of insight on the reality of the part, which is why that part's taking over. If I were to, so for the exile, if I were to not react in a perhaps childlike manner of screaming and yelling, or demanding that you pay attention to me, or threatening to quit, or whatever it is, if I don't react that way, I'm afraid you won't pay attention to me or take me seriously. And a lot of times that exile is stuck in a really early time where it just didn't have the lived experience yet to know what to do in a sophisticated way. It just did what was available, which is scream, yell, demand, threaten to walk out, I'm running away, whatever it is. So we really do the work with that exile to help it leave that place where it feels stuck, and to help it get its needs met.
What does that look like, the work that you do?
So, well, it can look a lot of different ways.
Right.
So imagine that your client is now that exile. And we're going to, one approach is, I want to invite you just to really see this part of you, this part that's feeling really stuck and quite vulnerable right now. Maybe you use some imagery. Pretend that you are looking in on it in a room. Maybe there's a one-way mirror, two-way mirror, whatever it's called. It doesn't know you're watching, but you're just watching it do what it does, be who it is. What do you notice about it? So then we start to have our client identify traits, what's happening with this part. And we ask them how they feel toward it. Well, again, if it's anything other than some compassionate, curious, confident place, we've got more work to do. We say, okay, well, I'm weighing in my mind how far I want to go into this. Because again, I mean, there's an extensive training, right? So I don't want to like try to encapsulate this and like just do that. So we spend more time with it. Basically, we try to work on that. Means a protector is still blended with the self, and analyzing or shaming or labeling that vulnerable part. So we pause on the vulnerable part, the exile, and now we do the work with the protector. What does it need in order to step out of the room? And quite literally, I say that, hey, could that part step out into the lobby? This part that's got a lot of labels and words and really just giving this vulnerable part of you a hard time. Could they wait out in the lobby for us? I promise we'll pick them up when we're finished on the way out. We're not going to leave them. Sometimes it's an immediate, yeah, sure. Yeah, they're gone. All right. So then we come back to the exile. How do you feel toward that part now? Gosh, kind of feel bad for it. I feel like I just want to go sit next to it, let it know it's going to be okay. There's our access point. So there's the compassion, there's the curiosity, because that's where we learn what's happening for that part in their reality, not some other part's reality.
Okay.
And I don't want to get stuck in an example because it might lead to just looking for that specific thing. But so you are being curious as the therapist. You're really sitting there, and maybe another part of the unblending in helping that vulnerable part get its needs met is, I wonder if you could ask it what it needs right now. Does it know? Maybe it knows, maybe it doesn't. If it does, okay, well, how do we get that need met? How can we facilitate that for that part? And then we use imagery. We actually map that out and say, let's do that. If it doesn't know what it needs, well, I wonder, while you're feeling compassionate toward this part, if you could now just enter the room. We've been watching it. It doesn't know we're watching. I wonder if you could enter the room. Let it know you're here. Maybe you want to introduce yourself and let it know you are only here for support. And ask it if it minds if you just come sit right next to it for a little while. You just want to be here. So it knows it's not alone in whatever it is it's going through. And then we kind of walk that line and see how far we need to go in order to feel that compassion, feel that support, and then empower them to meet this needs part. To meet this part's need.
Yeah. So are some clients resistant to this whole parts idea and talking to them, like in talking to these parts? Do some people say, I'm not going to talk to myself? Like, that's just odd. Like, I'm not going to do that. Like, and if so, how do you get them to try it out?
Yeah. Yes. The answer to that is yes. Sometimes people are like, so you want me to talk to myself? And I'll just say yes. And so, depending on, what I know about the client already, or what they're coming in with, I use humor a lot to try to break the ice a little bit. And I'll say, when no one else is around, and I mean no one, you don't talk to yourself. And I don't say it like I'm saying that to you. Like, yeah. I don't usually say it with that kind of tone or attitude, inflection. And it actually, sometimes it depends on the relationship I have with the client. If I've known them for a long time and I know they're kind of just being defensive, and like, really, you don't talk to yourself when you're all alone? Well, yeah, I guess I kind of do. But doesn't that make me crazy? No, not at all. Because you know what? Everyone I know in some way or another talks to themselves. Maybe it's not even out loud. Maybe it's just you're aware of a thought that you're having and you're engaging that thought. This is something very similar. And that's kind of how I, desensitize to this guard. Or if they're really, really like, no way, maybe I take another approach. maybe I don't stick with this one line. Or I recognize that there's a protector who is really not willing to relent. They do not want me going down in there and messing around in the foundation, because this whole house could tumble. And they've done a lot of work to keep this house up, with a lot of patchwork, a lot of recycled nails and found wood to keeping this house up. But they've done it, and they're not going to let me in there. So I work with the protector for a little while. Say, okay, fine. We don't need to talk to parts. I'll engage the part directly, because it's so tightly blended with the self. It's not going to let go. So now I just start engaging that part directly. What is it that you're afraid of, by the way? What is it that, you're coming into my office, I wonder how you're feeling about being in a therapist office. Maybe I'll say something like that. And then, so just briefly, I start engaging the part directly.
And when you're engaging the part with somebody who's resistant, are you doing so talking to them, or are you say, I'm going to talk to this part?
Yeah. So if it gets to the point where the part is so tightly blended with the self, and they're just, not interested, they're like, I'm not going to talk to myself or my parts, or I don't have parts, or whatever it is, I'm engaging as if the part is the person. Okay. So I am speaking directly to them like that's the self, but I know it's not the self. Right. So I don't use language like, let's talk to the part just yet. I just go, you. I say, you. What's your experience? Okay. But I know I'm talking to the part and not the person, the self.
So when you're working with a client and you get the part to let the self come back into control, how do you know that when you see it?
That's a good question. So the approach that I was explaining earlier about using imagery, see that vulnerable part, the exile, and just notice what it's doing. How is it? How do you feel toward that part? So I look for language, or I listen for language. If it's, I really think they need to suck it up and get it together, or I really wish they weren't so weak, or whatever it is, any kind of labeling or something that's not compassionate, I know that it's blended. So I know that the self, that they are now being self-led, examining this part. When I hear things like, gosh, it must have been really tough. Or maybe they just say it directly. That was a really hard time. I don't know how I got through that, but I sure did. Or something like that. So you're listening for basically just general kindness, right? So being kind toward themselves, self-compassion. If you're familiar with Kristen Neff,
so compassion rather than criticism.
Yeah, that's a good way to summarize it. Yeah.
Okay.
So, I think I could go like forever into this. So it might be helpful for me to pause and send it back to you of what would be helpful to know.
Sure. No, thank you. That was great. And I have a ton of questions. I'll just do a few. A question I have, and is IFS insight oriented? Is it action oriented, like CBT or DBT, or like, when people talk about an orientation of a specific modality, like how would IFS fit into that, or would it?
I think the cheap answer is it's both.
Okay.
Because it is inherently dependent upon the therapist being attuned and present. So we trust ourselves, right? We've got parts. We have therapist parts. We have parts that are really good at acting and playing the role of therapist.
Yeah.
So, I'm humble enough to admit that, I will be really in with a client sometimes, and I'll hear myself say something, and then in the back of my mind, I'm like, wow, I am so full of shit. Like they're like, where did that come from? And of course I have to do work to like, okay, I'm not being self-led. I need to get back into myself. So I will feel my feet on the floor, or I will, come back. Sometimes I even say, you know what, hold on just a minute. Let me come back into what we're talking about. which is really humanizing for the client, by the way.
Yeah.
I mean, it's like, oh, okay, so you're working on this too. It's not bringing my own stuff, it's the process. Yeah, we're all these parts, right? Everybody has this. So, that's the where I offer something that's genuine. I'm totally present and I'm offering something that comes to me because I'm so attuned to what's happening for you. That's the insight piece. The pragmatism, or the following the model piece, is there are lots of ways that we're taught to approach something. So we are taught how to unblend. We are taught how to recognize blending. We're taught how to communicate with particular parts. There's a I don't have a word for it, something that happens, like a phenomenon called polarization. So when two parts are feuding, for lack of a better word, and one is afraid that if it relents, the other will dominate. So it won't let go. So we have to negotiate, right? And there are there are ways that we can do that. So it is a bit model or practice based in a similar way to maybe DBT or something. But it's not prescriptive like CBT would be. It's not, you have a distorted thought. Let me help you understand what your distortions are and how to fix it so that you can see the world a little bit better. And I know that's a bit of an overgeneralization of CBT,
Sure.
but it is really about being attuned with the person and aligning with the person more than the procedure. The procedure is important, but that's secondary to aligning with the person.
So are you, as a therapist, teaching the person how to kind of do this insight on themselves and doing the action on themselves so that they can think to themselves, okay, I think this is my, angry dad part that is overriding the kind and loving dad part, or that's overriding the self, I guess I should say. And so I need to do this. Is that the goal, is to get the client to a place where they don't need you anymore?
Absolutely. Yes. Okay. Yeah, it's a great question too. I find that's another draw that I have to it. I find that it is more empowering to the client. Whereas in CBT, boy, they have mastered this particular thought distortion of, maybe they're overstepping in a relationship and it's a lot of projection, and once they recognize that, okay, good, I know that's what's happening, so, and I know how to correct that, and maybe I even do it automatically now. So cool, we take a break, 6 months, 2 years later, this new thing is coming up and I've tried all the skills that we've learned and it's not working. It's not an uncommon thing to hear. So with IFS, I think it leaves some of that. This is exactly what I do in this situation. It leaves that alone, and it's more about listening with attunement, being curious. I notice I'm really reactive right now. Okay, so let me get to a place where I can have some compassion for whatever's happening. And then I get to that place. Okay, what's going on here? Really, what does this part need that's not getting met? And how old is it? What is it responding to? And is that actually happening right now? So that's a little bit of a mesh between mindfulness-based cognitive therapy, IFS. But I do that a lot, and that's why IFS is so great. Is because if you want to really just kind of map out a model, you could do that. You could do just IFS, but I think it's so great for just instinctively pulling in so many other approaches here that it just flows out beautifully.
So can you just tell us just a quick bit about where this concept of interfamilial systems came from? Like, who brought it, and how did that come about?
Yeah, so I think it was the 80s. Richard Schwartz, family therapist, was noticing that people were using this language, a part of me. So he'll tell you in some of his interviews and trainings, he's he also subscribed to this idea of, maybe the client's not bought in, or, do the homework, or nothing's going to change if we don't do this thing. And so he just started experimenting with, I guess that's my word, I don't know if that's his word, but with, well, let's embrace the parts. Let's really lead into this and see what's going on for that part. And then from there, this developed. Initially, where it was most effective was eating disorders. And, as I mentioned earlier, one of the firefighters' modalities is to escape. So it's a reacting part, right? So binging, purging, starvation, other types of eating disorders. So there's a part that's overreactive. What is it reacting to? Well, what's going on for the exile that it's reacting to? And we really help that exile be unburdened and finally just integrate with the other parts. We're not reacting to fear or threat. And the results were quite amazing, actually. So symptom reduction, I think in 2015 is when they reached the evidence-based practice status. Based on longitudinal studies. They've got a lot of pilot studies that are out there. Some are showing more significant symptom reduction using IFS than, I think the one I'm thinking of specifically is clients presenting with anxiety. So enough, anxiety to interfere with functioning, maybe like a generalized anxiety or something. So the efficacy that they showed was that symptom reduction was significantly more with IFS than it was with CBT and interpersonal therapy. So now we have pilot studies of showing eating disorders, trauma, PTSD. I read a study that 92% of people coming into the study, and I forget the methodology of how frequently they met and for how long each session, but 92% of the participants no longer qualified for the diagnosis of PTSD by the end of the course, by the end of the IFS specific treatment.
Wow.
So basically one of the people still met criteria for PTSD. I think hopefully we're moving to a trend now in this field where we understand personality disorders not so much as a chronic problem. Like we used to have the axes in the DSM-4, it was an axis 2. Can't get insurance to pay for it, and strap in, buddy, because this is a lifetime sentence. Well, okay, maybe it is going to be chronic. But that's the other beautiful thing about IFS for me personally, is it really reshaped intentionally. I mean, this was pointed out directly in my training. It really reshaped the way I interpret personality disorders and the way I interpret myself and my ability to treat a personality disorder. So I'm no longer reacting to a borderline personality disorder or a person with borderline personality disorder as, oh my God, they're going to combat me all the way, and I just don't have the energy to take that on. Well, so I get centered, I get self-led, and I work with the part that is doing that, or parts that are doing that. Help the parts unblend, get their needs met, and get this person to be self-led. Now, are they going to stay there 100% of the time when they leave my office, or do they even get there every time by the time they leave my office? No, not necessarily, but it is complex work. But I think what it's done is it has now empowered me and some other therapists. All of our therapists at the Peaceful Place have had training in IFS, at least the introduction. And they've all said, "Wow, this is better than the way I had been treating personality disorders before, because it can be overwhelming. It just can be."
I've heard a lot of therapists say they won't treat personality disorders. They'll refer them out and deal with by BPD, right? Borderline personality disorder. So has this strengthened your practice in your ability to deal with with clients who have these challenging disorders?
Absolutely.
Mhm.
Something I noticed years ago was, when I was a young clinician, I would refer out for personality disorders. Probably, largely because I was intimidated, but also because I felt like it was unethical for me to take that on because I was intimidated and I just did not know what to do for this
Yeah.
person. But see, that puts all the burden on me to now fix this person's problem, or at least help them fix their environment, because that's
Mhm.
not going to change, nor are they, based on this former concept. And also, what that meant was I turned away a lot of women, because in the DSM, women have borderline personality disorders, only small percentage of men. But what I really started to notice was a lot of the men that I see, and a lot of my work is based in helping men develop a healthy relationship with masculinity in relationships and just in general. So I started to see a lot of behaviors and a lot of perceptions and mindsets that were really reminiscent of BPD. I just couldn't put my finger on it. I was like, I would consult with their psychiatrist and we'd both be like, this guy, he's kind of presenting with some personality disorder, don't you think? And we'd both agree and say, well, what is it? It's unlikely that it would be borderline personality disorder because it doesn't manifest the exact same way the DSM articulates. But you're not accounting for all the socialization, all the grooming and conditioning that men, particularly men who are believing they have to be hypermasculine in order to have an identity, that shapes the way our behaviors manifest. So you start removing this very narrow view of borderline personality disorder. Well, boom, they check the boxes. So now what do I do with them? Do I let them go because I don't do personality disorders? Nope. So, it's a way of really sitting with them, working with the parts, helping them identify the parts. There's a part of me that's really reactive right now. There's a part of me that just, to quote a client recently, there's a part of me that just wants this useless bitch to get out of my house. And that's not their usual mindset of women or partners or anyone. But there's another part of me that feels so lonely and defeated at the thought of her leaving. What would I even do? So now we have the exile and then the protector that wants that exile out of here because it's too weak. It doesn't meet the identity of a man. So work with the parts. But see, the behaviors start to manifest as that push and pull that we identify with borderline personality disorder. And they started to do that with all their relationships. Turns out this particular person that I'm thinking of, his mother, sounds like she presented a lot of signs of a personality disorder. So anyway, I know that was a little long-winded, but I do feel more empowered to really sit with, because that's what it's all about. You got to sit with and be present and attuned with the client and their parts. Understand the parts, not pathologize them.
Well, thank you so much. I know we're out of time. Just wanted to ask you, is there anything that you wanted to add to what we've discussed today?
Yeah, I don't know. I feel like I've talked so much and thrown so much at all of you. What I would add is, I think you're going to learn so much in grad school, and all of that provides such a good context or foundation. And then this is the stuff, your postgraduate experience and your postgraduate training. Now when you're out there doing it, you've got context. And I think that's going to be the big difference of, I can really see how this would work with this particular client, or I know how I feel as a therapist. And then, getting her training on how to come back into yourself and not let a part of you dictate or dominate the session. So I think that's kind of the thing that I feel like is really invaluable is, trust yourself, trust the process, go get training. Don't just take the cheapest CEU thing that's out there, right? Just to get your hours.
Yeah.
Go really invest in. If this is something you're interested in, there are lots of ways to meet your hour requirement and really specialize or really get good at this particular thing.
Okay. Well, thank you, Patrick. I really appreciate it.
You're welcome. It's been my pleasure.
All right. Have a lovely afternoon.
You too. Thanks.
All right. Cheers.
Bye.